2+ bilaterally. We're going to assess her posterior tibial. Sometimes it's a little hard to find. You just kind of have to push a little more pressure. Okay. And then her dorsalis pedis, which is right on top of the foot. So all pulses are positive ×2 bilaterally. I'm going to have you go ahead and rotate your feet for me. Okay, and bend one leg up at a time. And take your knee out to the side. Kind of check hip flexing. Do the same on this side. Okay. I'm going to have you pull your toes to your nose. Okay, and push against my hands. Okay, good. Okay, I'm done with that. Now I'm going to go ahead and say the things that I forgot to do. First, you're going to identify your patient. I'm going to ask her, can you say your first and last name?
Katie Edson.
And do you know your date of birth?
4586.
And where you are today?
St. Clair.
Okay, and do you know why you're here?
To get a full assessment.
Okay, so you're checking a level of consciousness, so she's alert and oriented, she knows where she is, she knows the date of birth and her name. So you put an identification bracelet on her, and then I'll have you close your eyes, and you place an object, and you have the patient just kind of see if they can tell what kind of object is placed in their hand. And can you tell me what kind of object that is?
Paperclip.
Correct. So she's able to distinguish objects with their eyes closed. And then you also have the patient close their eyes and assess their sense of smell and taste. Just make sure it's nothing too foul.
Alcohol pad.
Correct. Have you keep your eyes closed. I'm going to place something in your hand, and you tell me if it's bitter, sweet, sour, spicy.
Sweet.
Okay, and she's right. And then we, usually with the hearing test, you do the Weber and Rhines test. You take a tuning fork, and you place it on the top of the head. And I would ask you, could you just tell me when you stop hearing the sound.
Okay.
Okay. And then to check the Rhines test, you hit the tuning fork and put the tuning fork on the mastoid bone. And also ask the patient to tell you when they stop hearing.
Okay.
And then you hold it towards the ear and then tell them also to tell you when they stop hearing it. Okay, and you repeat this on both sides. And then also one more thing I forgot, I need you to puff out your cheeks, raise your eyebrows, stick out your tongue, wiggle side to side, shoulder shrug,